Have you been dealing with this nagging shoulder pain post-op surgery and no amount of rotator cuff strengthening or shoulder exercises seems to fix it? This discomfort is especially painful when you bring your arm out to the side like this. My name is Mal, my pronouns are they, them, and I'm the founder of Proud Movement, and I had top surgery back in March of 2022. Now, I'm speaking from personal experience today because I was dealing with very mysterious shoulder pain post-op surgery, and I was treating it like I had weakness or muscle weakness. I tried to rehab for a year and it just didn't get better. I have another video about, some nerve glides that you can do post-op surgery that can be quite helpful. But this video is about one specific nerve. This is the axillary nerve. And the reason I'm making a full video about this nerve is because I really have found that through my own personal experience and connecting with other people post-op, that I find that the axillary nerve can be the nerve that gets the most irritated post-op, and I think it's due to the location of the nerve. Basically, all you need to know is that this nerve is in kind of the perfect position to get compressed or irritated, especially during post-op healing. Now, the axillary nerve supplies the shoulder and also one of your rotator cuff muscles in the back here. So think more like upper arm region. Now, I think some factors that can contribute to this nerve becoming irritated is number one, arm positioning during the actual surgery. And we also have to consider swelling can affect how the nerve glides. Also, scar tissue and tight fascia can also affect how nerves are gliding. And then the last thing we have to consider is like drains and like stitches. That can also affect nerves as well. I'm creating this video because I experienced this and I have connected with at least 5 or 6 people who have also experienced this post-op surgery. It would have been really helpful when I went through the top surgery process to have had this video available. I rehabbed my shoulder for like over a year and saw no positive results. And if I would have just known how to do a simple nerve glide, this would have gotten better a lot faster. If you're post-op surgery, you're experiencing some shoulder pain, you're doing the regular, shoulder strengthening exercises, and you're not seeing any positive results, consider the axillary nerve, okay? And I'm going to show you a gentle technique that you can do right now. The first thing we want to do before we actually do the mobilization exercise is actually assess our movement first and to see if this nerve glide actually improves our movement. So we know the movement that really irritates this nerve is that kind of lateral movement. So out to the side, like a lateral raise. You can always add a weight to it and just try it out to the side here. And you just want to like test this out, maybe like 2-3 times, nice and slow, and just kind of noticing like where you're really feeling that discomfort and that pain, okay? And then just take mental note of that, see how that feels, and then we're going to actually do the nerve glide. So the first thing you're going to do to perform this nerve glide is you're just going to stand up. And then you're going to take one arm, the affected side, and you're going to bend the elbow so it's at about 90 degrees, okay? Nice and relaxed in this position. Then I want to make sure that the shoulder itself is in more of an internally rotated position. So it's almost like falling forward, okay? I don't want you to like push it forward, but I want you to just feel like that arm is relatively relaxed. Okay, so the elbow is not higher than shoulder height. Okay, you're not up here. It's just nice and relaxed here, okay? And then what you're going to do is you're going to take that arm and you're going to gently pull it behind you. Once you've done that, you're going to depress the shoulder blade down towards the floor. So pulling it down. Okay, immediately I should feel a little bit of nerve tension there, okay? So I'm feeling it in a little bit through the front of the shoulder and maybe a little bit in the back as well. Okay, if you're not feeling it yet, there's no need to panic. You'll probably feel it in just a moment. So again, arm is here, nice and relaxed, pull it behind me, depress the shoulder. Once I've done that, I'm gonna tilt my head to the opposite shoulder. And then I should feel a little bit of a stretchy feeling. This could be, through the neck a little bit, through the shoulder, maybe the front, maybe the back, okay? Because what we're doing is we're actually tensing up that nerve. So once we have a bit of that tension, all those steps here, I'm just going to gently perform small circles forward coming from the shoulder joint. As I do this, I want to think about keeping all of the points of setup that we worked on. So we want to make sure that we keep that bend at the elbow. We want to make sure that we keep that scapula pulled down. And it's just gentle little circles here as we keep that head tilted to the opposite shoulder. You're going to do 5 circles one direction, and then you're going to do the same thing, 5 circles the other direction. Now, in terms of stretchy feeling, we don't want to exceed like a 3 out of 10 for stretch. Basically, you can stretch your nerve quite hard, and this can irritate the nerve even further. Okay, and we're not trying to irritate the nerve any further right now. We're just trying to get a nice, gentle mobilization through it. So it's really important that we stay at about that 3 out of 10 for stretch, okay? Even if you think the further stretch you go, like the better results you'll see, no, that's not true, okay? Because again, if we overstretch that nerve, it's gonna become more irritated, and that's not the point of this exercise. So let's do this together. 5 reps one direction, 5 reps the other direction. So again, I'm standing up. I'm going to take my arm. It's nice and relaxed here. I'm going to make sure my shoulder is slightly internally rotated. Okay, I'm nice and relaxed. I'm going to pull that shoulder back, depress the shoulder down, and then tilt the head to the opposite shoulder. Keeping that shoulder blade in a depressed position, I'm going to perform very gentle, small little circles coming from the shoulder. Good. High quality movement here. We're not rushing through it. And notice how my arm stays relatively behind the body. Okay, it's not coming kind of beside the body or in front of the body. It's staying relatively behind here. Good. We're going to do about 2 more reps here. Should feel just a nice gentle stretch. Maybe through I'm feeling it personally through the front of the shoulder. Good, but again, it shouldn't be too intense. And then now I'm going to change the direction of that circle. So now I'm going to go backwards. Nice and gentle. Good. Okay, let's just take a little rest there. Good. So in terms of frequency, you could do this up to twice a day as long as you're staying at that 3 out of 10 stretchy feeling. You're not overdoing it. But I would start with once a day if you're brand new to this exercise, and then just see how your body responds to it, okay? Because every body is going to respond differently. So you just want to make sure that you're not going to further irritate anything. So start with once a day for about a week, and then you can increase to twice a day, but no more than 5 reps per direction, and staying at that 3 out of 10 for stretchy feeling. Important now that we've actually done the nerve glide that we go back to that assessment that we first did. So we're going to stand, we're going to bring our arm out to the side, and I want you to see if that improved anything. Because if it did, that means that we're obviously getting some benefit from the exercise, and that nerve clearly is a little bit irritated, maybe compressed, and that over time, we're really going to benefit from this exercise, especially if we're doing it daily. So just testing that out about 5-6 times. If there is improvement, that's great. I would continue with this exercise daily.